And Jean and Kathy, do you guys want to give a little overview, Jean, of how you know Kathy and how she came to be? And then we'll let Kathy go ahead and start.
Hi, my name's Jean Shaughnessy, and I met Kathy last year. We were talking about Medicare and the positions available within Medicare. So I had the opportunity of meeting Kathy, and because of our group and discussing Medicare and getting older, I thought she would be an excellent source for information for us all. So, Kathy Madden.
Hello. So I'm Kathy Madden. I'm with the Division of Insurance's SHIP program, and that stands for the Senior Health Insurance Program. We are a volunteer organization that is all over the U.S., in all the U.S. territories, including Puerto Rico, Guam, Virgin Islands. We're basically a volunteer organization. I'd say probably 80% of our folks are volunteers, and they come to us from, we get retirees, we get students, we get people who have worked in the medical field in the past, and they come to volunteer with SHIP, which, we're happy if any of you are interested in volunteering, please reach out to me. We're always looking for new volunteers. Like I said, we're in every state, and I'll give you some statistics on what we do at the end of the presentation. But for now, thanks for being here. I know Medicare is a very complex subject, and there's a lot of moving parts, right? I mean, it's never really just cut and dried. There's always some little, weird component to it. But overall, Medicare's been pretty stable over the, since its inception. Of course, the Part B premium's gone up substantially. There's been some changes, within Medicare, like Medicare Advantage plans now are much bigger than they ever used to be. So there's those kind of changes, but for the most part, Medicare's been pretty stable over the course of the years. Do you want to go ahead and advance the slides? Thank you. So what is Medicare? Medicare is a national health insurance program for people 65 or over or under 65 with certain disabilities. So you can get on Medicare if you are deemed disabled and under 65. You can enroll in Medicare whether you're still working or not, right? Back in the day, people, retired at 65 and they got the gold watch and they got on Medicare and they retired. Now, lots of people are working past age 65, even though you can get on Medicare at age 65. And I'll get into a little bit about that in a minute, but you can enroll whether, you're still working or not. And, we would probably, as SHIP counselors, talk to you about your current job and what your insurance looks like there, because Medicare might be better than your employer-sponsored insurance. Enrollment is handled by Social Security, not Medicare. They handle all of the enrollments and disenrollments. Medicare is not to be confused with Medicaid. Medicaid is an income-based program, and there's eligibility limits, whereas Medicare, it's either you're 65 or you're under 65 with disabilities. Next. So who is eligible? People 65 or over or under 65 with certain disabilities. People lawfully admitted for permanent residence to the U.S., meaning you've had to reside in the U.S. for 5 consecutive years. Spouses that hitchhike on another spouse's work record, meaning you have a couple, one spouse works in the home, one spouse works out of the home. The spouse that works in the home can collect Social Security when they turn 65, just like the spouse that worked outside of the home. Disabled adults and children, if they've been receiving Social Security disability benefits for 24 months, are now eligible for Medicare. And a lot of times this is funny because people forget they signed up for Medicare. They signed up for disability because it takes 2 years for it to go through. And by the time the 2 years is up, they've forgotten. And so they call us because all of a sudden they're signed up for Medicare and they don't know why. And it's because the 2 years was triggered. Now they're on Medicare and they need to pick a plan and all of that. People with ESRD or ALS, which is Lou Gehrig's disease, those folks are also eligible for Medicare. And my guess is because those are such fast acting diseases that they want to make sure that people get on Medicare sooner rather than later. Next slide. So what is a Medicare card? It's a red, white, and blue card that identifies a person as a member of Medicare. It gives you the effective dates of A and B on there. It indicates a claim number. The claim number was changed on everybody's cards in 2019. There used to be a Social Security number on all of these Medicare cards, believe it or not. And so they decided in 2019 that's probably not a good idea. So they changed the Social Security numbers to a number letter indicator. It's just a random numbers that aren't really traced back to any state or anything. But it's much safer for Medicare beneficiaries to carry their cards around now. But if your card is stolen or lost, you can contact Social Security or Medicare to get a replacement card. You'll get a replacement card, but it'll be the same letter number combo as you had before. Next slide. And this is just what a Medicare card looks like. It's just a paper card, literally. Here's the number letter indicator. It lists your Part A and Part B effective dates. And I don't know if you know, but Medicare has 4 parts, A, B, C, and D. They don't put C and D on the card because those options can change yearly. And so those dates would change and they don't want to send out new cards to everybody. So they only put Part A and B because those are pretty stagnant dates, right? Once you're on, unless you're on and you decide you want to go back to work, then you have to rescind your Medicare. And I try to talk people out of it unless they've got a great paying job that they want to get into, because really when you have 2 effective dates of Medicare floating out there, it's ripe for error. So I make sure people really want to retire before they get on Medicare, or they really want to go back to work before they get off Medicare. Next slide. So the Medicare cards arrive. Now what? So you can decide you're keeping A and B, you're going to retire, and you're getting on Medicare. So you're going to keep the card with A and B. Most people take Part A because it's free, premium free, right? And it's premium free, meaning you've had 10 years or 40 work quarters with Social Security. And at this stage, most of us have, right, 10 years or 40 work quarters. If you have that amount of time in with Social Security, your Part A hospitalization is going to be premium free, meaning you don't pay a monthly premium to have Part A because you've essentially done that throughout your whole work life. But you do pay for services when you have to be hospitalized and use Part A. So it's not free, it's premium free. Okay, you don't pay a monthly premium. Some can defer Part B due to having active current employer coverage, which is what I did. I became eligible for Medicare in September, so I signed up, but I'm still working. Right? And I'm going to be on para when I do decide to retire. So I decided, you know what? I'm just going to go ahead and get my A, right? Because I don't pay for it monthly. It's sitting in the background in case I get hospitalized, and it'll act as a secondary payer to my employer hospitalization insurance, right? I don't want to get Part B because Part B Medicare is $205.90, and I'm already paying essentially a Part B premium with my employer. So I'm going to defer Part B until I retire. And I went ahead and got my A just because I've already paid for it. And it's just sitting in the background in case I need it. Okay, next slide. So again, there's 4 parts to Medicare. A is hospital insurance. B is medical insurance. I guess the best way to explain that would be, let's say you are playing with your grandkids and you twisted your ankle and you have to go to the hospital, and you go and it's not emergency. Let's say it's not emergency. You have to go see a doctor, and they cast and they do all this stuff for you. That would be covered by B, not A, because you actually went to a doctor to get these things done. You didn't go like you weren't hospitalized. C are your optional health plans, like your Medicare Advantage plans, or your Medicare supplements. And those are also known as Medigap policies. From what I understand, Para no longer offers Medigap policies with their coverage, but you can get a Medicare Advantage plan through Para. I know when I started here, Para offered Medigap plans. I don't know when that ended, but from what I understand from folks that are already on Para, they no longer offer Medigap. Now, that doesn't mean you cannot get a Medigap policy. You just would not be purchasing that through Para. Part D are the Medicare prescription drug plans. Medicare says everybody needs to have a prescription drug plan, whether you get it through the VA, whether you get it through, where else would you get it? Like an employer or a third party private insurance, you have to have a Part D prescription drug plan. But what you'll read in the literature everywhere is that it says it's voluntary to get a Part D plan. I'm not sure why they word it that way, because if you don't do it when you're first eligible, you'll get penalized. So I don't know why they use the word voluntary, because it is not voluntary. I guess it's voluntary to enroll, but if you don't enroll in a Part D plan, if you're on Medicare, you will get penalized. And a lot of our seniors will say, hey, I don't even take drugs. I just do vitamins. I walk every day. You still have to get a prescription drug plan. And there are drug plans out there that have zero premium. So it's really just sitting in the background in case you do get put on drugs that year, right? Because that could happen. It's just sitting in the background, but you're not making a monthly payment to have that drug plan. Next slide. So again, Part A is usually premium free, right? And I say, what? You have to pay for Medicare? You would be shocked at how many people call our office and say, I didn't know I had to pay for Medicare. I thought I paid Medicare my whole working life. And you did, but there are still costs associated with Medicare. In 2026, the Part B premium went up to $205.90 from $185. So that was probably the highest increase that I'd ever seen since I've been here, and I've been here since 2012. So that increase was pretty high. Everybody pays this Part B premium if you have Medicare, whether you get it paid for you because your income is low, or whether you pay a higher amount because your income is higher. Everybody pays that Part B, as in boy, premium. Part C, again, are the optional choices. The Medicare Advantage plans, Medigap policies, or you can stick with just straight A and B original Medicare, but these choices also have premiums attached to them. The Part D, as in dog, deductible for 2026 is $615, and that went up from $590, meaning you have to pay that deductible before your drug plan kicks in. It's just like car insurance. You got to pay the deductible before the insurance will pay. So that's the same with the PDP prescription drug plans. Now, not every plan has a deductible, and not every plan has a monthly premium, and we'll talk about that in a sec. Next slide. Again, A is hospital insurance. Most people get that premium free if they've had enough work quarters in with Social Security, 40 quarters or 10 years. If not, your premiums will start at $505 a month for 2020, and that should be 2026. So most people get premium-free Part A, but if you've moved here from another country, you don't have the work quarters in with Social Security, you can pay up to $505 a month for your, actually it's $565 a month for your Part A premium. I would say not too many people pay a Part A premium. I think my notes say 5% of the people that get Medicare pay a Part A premium. It's not very many people. Any hospital stay on Part A means there's going to be a $1,676 deductible per benefit period. So if you get admitted on January 2, you're going to pay $1,676 plus your Part A hospital costs. If you go home, you're at, you've gone home and you've been at home for 2 months and you get re-hospitalized, You get that 1676 deductible again because it's per benefit period. Hospital insurance covers inpatient stays, nursing home stays if they're skilled, home health care, if it's approved by Medicare, right? People see that and they think, oh, I can get somebody to come in and help me clean and get dressed and all of that. No, that has to be approved not only by your doctor, but Medicare. Hospice and blood after 3 pints are also covered by Part A. Next slide. So Part B is where people pay the monthly premium of $205.90 per month. Some pay more depending on if they have a higher income. And we'll talk about, it's called IRMA, income related monthly adjustment amount. We'll talk about that in just a second. If you enroll late in Medicare, there's penalties that do apply. If you're receiving a Social Security pension, your premiums are automatically withdrawn. So let's say you're already on Social Security, you signed up at 62 and now it's 67 and you're going on Medicare. If you do that, your premium is going to automatically be withdrawn, the Part B premium from your Social Security. And we encourage people to do that because then you know it's paid, right? And if it doesn't get paid, you can go back to Social Security and say you were responsible for the payment and didn't make the payment. And so, but people say, yeah, I can remember, I can pay that on my own. I really discourage that because I don't know. I don't really remember what I had for lunch Monday. So I'm not remembering all these premiums and what to pay. So I tell people either put it, either Social Security comes out of Social Security or put it where it comes out of a bank account, not a debit card, not a credit card, because those things expire. And once again, you're in Rome on vacation, it expires, you don't get the message, they will drop you from Medicare due to non-payment of premiums. It's really the only thing I've seen people get dropped for Medicare for, but I think they give you a 1-month grace period and then they will drop you. If not, if you want to pay directly, and there are some people that do, and I got to say, they usually come back to me and say, you know, Medicare didn't get my payment, or they're saying I didn't, you know, if they get billed, they're going to get billed quarterly. So they don't get billed monthly, they get billed quarterly. And so just to 205 times 3, you're talking 615 bill quarterly. You know, that's tough for some beneficiaries to come up with all at once. But, you know, if they insist on doing that, you got to let them do it. But I encourage people to either get it out of their Social Security or direct from a bank account. And that way somebody is, you know, the bank is liable if it doesn't get paid. The Part B deductible went up to $283 in 2026, meaning let's say you hurt your wrist and you got to go to the doctor, there's going to be a $283 deductible before your Part D benefits kick in. And just below just gives you an idea of some things that are covered by Part B as opposed to Part A. Next slide. So these are some excluded benefits for both Part A and B. So drugs unrelated to illness, private duty nursing, long-term care, right? You can purchase the long-term care policy. Medicare doesn't cover long-term care. Medicare care outside of the U.S. is not covered by Medicare. So a lot of these people that are expats that are moving out of the country, you wonder, well, what are they doing for their Medicare? Lots of people are paying that $205 and maintaining their Part B, but getting their care in the country they live in. Some people drop Part B altogether because they say, I'm never coming back to the U.S., so I'll never need Medicare. That's risky business. But, you know, I give them all their options, but, you know, in the end, they're going to make their own decisions. Homemaker services are not covered. Non-emergency transportation services, like you can't grab an Uber to go to your doctor and have it covered. Routine dental vision care and hearing aids, believe it or not, are not covered by Medicare. Now, a lot of Medicare Advantage plans will offer this coverage at an additional cost, but these are not things that Medicare covers yet. And then alternative medicine, obviously, marijuana, I don't know what else you consider alternative, you know, Reiki, healing, all of those things are not covered by Medicare. Next slide. We briefly talked about IRMA, income related monthly adjustment amount. This is just the surcharge that it is added to parts B and D if someone's income is over a certain amount. And this surcharge, they call it, is based on your income from 2 years ago. And it's not static. So if your income goes down and you're no longer qualified for IRMA, then your Part B is going to be 205 like everybody else's. The threshold is if you're making over $109,000 single or 218 filing jointly, you will have an IRMA surcharge added to your Part B as in boy and Part D as in dog premiums. Next slide. And this is just a chart that shows you what you're going to pay if you fall in those rankings for those particular thresholds. So if you make 109 or less, you're going to pay what everybody else is paying, 202.90. It's actually 205.90. If you're above that, you're going to pay a little bit more. Well, a little bit more. That's quite a difference more. If you're at 137, you're going to pay this. Now, we don't really get a lot of calls about this because most people who qualify, they get something from Medicare saying, hey, you're going to get this IRMA surcharge. I've only gotten a few calls from people, a little angry that they're paying this surcharge. But again, I'll take this problem any day. If I had to have a problem, this would be the one. So, and we don't SHIP or Medicare. We don't assess, this is a Medicare thing, not SHIP. We don't get involved in, who pays what, but we can tell them that they will have a surcharge if, they're wealthy enough. Next slide. There are some enrollment periods that people need to be aware of. So the first one is your initial enrollment period, and it's the 7 months around your 65th birthday. So my birthday was September. I had June, July, August, September, October, November, December to sign up for Medicare in my initial enrollment period with no penalties. And that's exactly what I did. So I'm good to go. The special enrollment period, that's for people who it's 6 months from the loss of creditable coverage. So let's say somebody is in January and they say, you know what? Thinking about retiring. I just don't know yet. I don't want to sign up for Medicare because I'm not quite sure. But how long do I have from the loss of my creditable coverage through my job do I have to pick up Medicare? And that would be an 8-month window you have there. You have until August, if it happens in January, to pick up Medicare with no penalties. And most people don't do that because they already know they're either going to go on Medicare. This is just for folks who just haven't made up their mind yet. I do want to mention here that a lot of times when people leave their jobs, they are offered COBRA insurance. And COBRA insurance is great, but there are so many different types of COBRA insurance out there that for Medicare, COBRA is not considered creditable. And creditable just means as good or better than Medicare. And because Medicare wouldn't know what somebody coming on to Medicare from a COBRA plan had, we consider all COBRA plans not creditable, which is kind of wild because COBRA is expensive, right? You would think if you're on a COBRA plan, you're good, but no. And a lot of HR departments don't tell people this. And so they look at it and go, well, I'll just stay on COBRA for 18 months, right? Buy myself some time. But after that 8 months, now you're in penalty territory with Medicare, right? Even though COBRA lasts for 18 months, that has nothing to do with Medicare's enrollment period. So I've had that happen too, where people say, oh, I didn't know my HR. And COBRA's expensive. So that's another reason you don't really want to stay on a COBRA any more than you have to, right? I can guarantee that Medicare is going to be a lot cheaper. So the general enrollment period is for folks who miss this first enrollment period or this second for any reason. They give you another enrollment period. And that enrollment period is January 1st to March 31st, with coverage becoming effective the next month. And that's for folks whatever reason they missed these 2 enrollment periods. There's a third one you can you can join. The last one is fairly new. This one came in 2019. It's the Medicare Advantage open enrollment period. And I think I just spoke with somebody, Gina, about that. If you are in a Medicare Advantage plan on December 31st of any given year, you are allowed a 3-month grace period, January 1st to March 31st, to change to another Medicare Advantage plan, to go back to original Medicare and get a Part B standalone drug plan, or to get a Medigap and get a standalone drug plan. So this has really been great for our beneficiaries, because a lot of times they switch their plan during open enrollment, which is October 15th through December 7th of every year. And then they go to the doctor in January and realize, I don't like this plan. My doctor doesn't take this new plan. Like, it's too far from my house. There's a lot of reasons. This gives them another opportunity to switch into another Medicare or go back to the one they were with. Okay, next slide. Late enrollment periods. Again, we talked about this a little bit earlier. Part A is 10% of the current Part A premium paid for twice the number of years eligible and not enrolled. And this is why SHIP doesn't get into this, because it's math. We don't do math. We let CMS and Social Security do math. So, but you can read here for yourself. There's penalties, right? There's going to be penalties. No, not for C or D. I'm sorry, D does have a 1%, and it's with the current benchmark beneficiary premium. That's not going to be as much as this one, right? This Part B premium can be a little bit higher, but you know, we try to get people to avoid any late penalties. You know, you don't see it a lot. People are out of the country. They forget. They don't know they have to sign up for Medicare. Like, there's a lot of reasons people miss these enrollment dates. Next slide. So let's talk about the 3 products people can choose when they get into Medicare. You're going to have 3 products. And again, I'm not talking specifically about Para, because I know they have their own products, but I can guarantee they're going to have some Medicare Advantage plans to pick from. So Part C, they're called Part C plans. You hear them referred to as Medicare Advantage plans. MAPD, Medicare Advantage with prescription drugs, because this Medicare Advantage comes with drugs attached. So it's health and drugs combined. You can join during any open enrollment period, again, October 15th through December 7th, with the coverage becoming effective January 1st. Medicare Advantage plans usually cover both health services and prescription drugs. They are run by private insurance companies, not Medicare, but they're regulated by CMS, which is Centers for Medicare and Medicaid Services. Next slide. So you'll hear them referred to as HMOs, PPOs, or special needs plans, and we'll talk about those in just a sec. This year, there's only, I think, 8 special needs plans that went down from 20. I mean, the amount of plans really shrunk this year tremendously. Next slide. So Medicare health premium factors, what do they look at when they're determining your rate? So it's by company and plan, right? Because you can get a plan with Aetna that has the same benefits with Blue Cross Blue Shield, but you might pay a little bit more with Aetna because that's what they're charging. It also is determined by your zip code. Your cost of your plan is determined by zip code, and also your prescription drug list, right? If you take 1 drug, obviously it's going to be cheaper than if you take 20 drugs, right? And so the premiums are based on all these factors that the company charges you. Some plans do have 0 premium though, and we'll talk about those in a second. Next slide. Again, annual open enrollment period is October 15th through December 7th. What can you do? You can change from original Medicare to a Medicare Advantage plan and vice versa. You can switch your current Medicare Advantage plan to another, or you can just change drug plans if you're like on original Medicare or have a Medigap. This year, there are 28 Medicare Advantage plans offered in Colorado, and that's down from 41 last year. Next slide. We do have one more newest enrollment period. I just talked about that, so I won't, beat this. But it is January 1st through March 31st. You can change from one MA plan to another, drop your NA plan, go back to original Medicare A and B, and get a standalone drug plan. So that's kind of unheard of until this came about. Drug plans, you weren't able to get one at any time of the year. Now you're able to get one at least during these first 3 months of the year as well. Next slide. The second product you can go into when you age into Medicare is called a Medicare supplement or a Medigap. They are considered Part C options. You'll hear them also referred to as Medicare supplements or MedSup, Medigap. I like to refer to them as lettered plans because each policy is lettered, right? And there's, I want to say 10 lettered plans. And usually when a client calls and I say, well, okay, what kind of coverage do you have currently? And they'll say, oh, I don't know. I think it's Medicare Advantage. And I'll just say, do you have to stay within a network? If they say yes, I know it's a Medicare Advantage plan. If they say, I'll say, is it a lettered plan? And they say, yeah, I have an F or a G, I know it's a Medigap. So then Medigaps are sold by private insurance companies as well. There's various plans offered, but each plan is standardized. So there's 10 lettered plans offered. And if you get, let's just say an A in Colorado, it's going to have the same exact coverage as an A in Maine, as an A in Idaho, right? An A is an A is an A. What changes is what the company charges you for that plan. And so we'll talk. Yeah. So the coverage is standardized. The premiums are not. Medigaps are not regulated by CMS. They are regulated by the Division of Insurance here in Colorado. So we can give information in that about Medigaps, but we don't file complaints around Medigaps or anything like that. They have a whole department in life and health that handles that. Next slide. So Medigaps, they call them Medigaps, they cover the gaps in original Medicare. So when you go with original Medicare A and B, let's see, that's the choice you choose when you go into Medicare. Medicare A and B covers 80% of Medicare approved services, with the client being on the hook for 20% of Medicare approved services. So if you go outside and get hit by a bus tomorrow and it's $100,000, you're going to be on the hook for $80,000. I'm sorry, with $20,000, with Medicare paying $80,000. Now, that's $20,000. I'm not sure how many people can come up with that, right? But that's how Medigaps, that's how original Medicare works. There's no cap on the amount of out-of-pocket costs from original Medicare. Medigaps, there is no out-of-pocket cost because either it's covered or it isn't. It's pretty cut and dry with Medigaps. It's either you have an A and it's covered or it isn't. And here you'll see all the lettered plans represented. You don't see an F anymore because it is the most popular plan. Most people pick an F, but they phase those out in 2020. Now the most comparable plan would be the G, with the only difference being the G, you have to pay a yearly deductible before you can the plan kicks in, whereas with the F, they didn't have a deductible, which is why I think they did away with the F. But if you have it and you're grandfathered in, you can continue to use it. But anybody coming into Medicare today can no longer purchase an F. But if you wanted something very, very similar, I would recommend the G. Same coverage, except there's a deductible. Next slide. You can purchase a Medigap at any time of the year. You're not beholden to that open enrollment period of October 15th through December 7th. But the company, as long as the company is accepting new applications, they want to sell you a Medigap, then you can buy a Medigap at any time of the year. Medigaps, though, they can make you go through underwriting or undergo physicals and deny you a policy if they want to. They cannot do it when you're in your guaranteed issue period, which is the first 6 months after you get your Part B, then they cannot deny you a Medigap for any reason because you're in your guaranteed issue period. So if you're going to get a Medigap when you get into Medicare, do it during that first 6 months of having your Part B, and they can't ask any questions. If you wait till that 7th month, they can start asking health questions of you and decide whether or not they want to sell you a Medigap. Next slide. Medicare Part D drug coverage are also known as Part D plans, prescription drug coverage, PDPs, or MAPDs, Medicare Advantage with prescription drugs. These are also run by private companies, but they are regulated by CMS. And that's why you're hearing in the news about CMS trying to bring drug prices down. That's regulated by CMS. Yeah. Next slide. So in order for a drug to be on Medicare's formulary, they have to be FDA approved and something that requires a prescription, meaning over-the-counter drugs are not even Medicare. Medicare doesn't cover over-the-counter drugs. It must be medically necessary and used for the purpose intended. It covers some Part A and Part B and all Part D drugs, depending on when or how they're administered. Most outpatient drugs are covered under D because they're self-administered sort of maintenance drugs. But if you're given a drug for like your swollen ankle when you're playing with the grandkids, that would come from B. Next slide. Prices are negotiated with Medicare. Again, you hear it in the news all the time. Plans manage access to their drugs, though, through formularies. You know, do they cover the drug? Not every plan covers every drug, right? But Medicare has made it so that all the plans have to cover a semblance of all the drugs, right? So there's nobody out there who is the company that covers all the expensive drugs or a company that covers all the cheaper drugs. There's a mix, right? So pretty much any plan you pick are going to cover the bulk of your drugs, but not every plan covers every drug. So just so you know that as well. They also manage their drugs through making sure you have to get prior authorization. If you have, if you need a drug that maybe isn't on the formulary, you might have to get prior authorization to get it. Step therapy, which our beneficiaries absolutely hate. This is when you go on a cheaper drug and they'll put you on the cheaper drug before they'll let you use the more expensive drug. And, you know, it takes months. It's not just a weekly thing. It takes months for this. So this is one way they do manage their drugs. And quantity limits. If you need 45 pills a month and your drugs plan says it's 30, then you got to get an override for the quantity limits. One way to alleviate or not have to do all this is to just get a plan that covers your drugs without all of these sort of making you jump through these hoops. Next slide. Drug plans are approved by Medicare. They're flexible in design. Again, they must offer at least a standard level of coverage. They can offer enhanced benefits. They can change year to year. They usually do change year to year. Some drugs are excluded from all the plans. Medicare just does not cover them. But let's say you're on a plan and then you get put on a drug mid-year and your plan doesn't cover that drug. You can ask for what's called a request, a drug authorization request, to get that drug put on the formulary just for you for the rest of the year. To me, I tell beneficiaries it's much easier to get on a drug plan that covers all your drugs instead of having to do this. But, you know, life happens. And if we have to go to bat for you to get your drug for the rest of the year, we can certainly do that. Next slide. The Part D enrollment periods, again, it's same as your initial 7 months around your 65th birthday. Same special enrollment period. If you miss this enrollment period for any reason, you do have a special enrollment period. But before, for your Part B, remember the special enrollment period was for 8 months. For Part D as in dog, the special enrollment period is only 63 days. So if you stop working January, you had January, February, and then the first couple of days of March to get coverage. They only allow a 63-day gap in coverage before there's no penalties if you try to join a drug plan down the road. Annual open enrollment period, again, October 15th to December 7th, with the coverage coming effective January 1st of the upcoming year. Next slide. Annual open enrollment period, again, it's when you can join a prescription drug plan, you can switch from one to another, or you can drop your plan completely. And, you know, during open enrollment, we really encourage people to check their plans. It's when we see the most of our clients during that part of the year. We see probably 60% of our customers during open enrollment. But we encourage them to call and look at their plans each year, because these plans change, you know, formularies change, doctors change, right? Even though they took Humana last year, they may not take Humana this year. You know what else that changes is premiums. I must have gotten 5 calls already this month about, yeah, I didn't get the literature. They always send something out at the beginning of the open enrollment period called the explanation of benefits or annual notice of change. And it tells you what's going to change in your plan for next year. But, you know, people trash that stuff. They don't look at it. And then they went from a, you know, plan for $12 a month to a plan for $60 a month. And they're, you know, now they need to switch back. So they do give you that open enrollment period every year to do that. Next slide. There's help paying for your Part D prescription drugs if you are low income. It is called the Extra Help or LIS program. It's run by Social Security, and it's for qualified Medicare beneficiaries needing help with their prescription drug costs. You can apply right online. They'll tell you if you're eligible or not. And I would say we have quite a few beneficiaries that get extra help. Not a lot, but we have quite a few. But it really does help people be able to afford their drugs. If they're eligible for LIS, they can change their Part D plan at any time of the year, and late enrollment penalties don't apply. They're already low income. Why are you going to, you know, now put penalties on top of that, or late enrollment penalties on top of that, right? So if you are financially eligible, low income, these things don't apply to you. Eligibility is established each fall by Social Security, whether you're eligible for extra help in the coming year or not. And it lasts for an entire year, just like Medicaid. Next slide. There are benchmark plans. Benchmark plans are for people who they're just plans that have zero premium, zero deductible, no coverage gap. But you have to be financially eligible for these programs. There are only 3 plans offered in 2026. And some people would be better off without a benchmark plan because of their medications. So this is something that SHIP counselors would help somebody determine, is a benchmark plan really the best for you? Because they aren't always, but you know, that's something that SHIP counselors can help you decipher. Next slide. There's also help paying for your Part B, as in boy, costs. They're called Medicare savings programs. And they're for people, Medicare assistance for dual eligibles. Dual eligible are people that get Medicare and Medicaid. We mostly here at SHIP sign folks up for QNB, which is qualified Medicare beneficiary. It helps them pay their Part A, Part B premiums, deductibles, and copays. If you qualify for Medicaid, you are going to qualify for QNB probably. And then we have specified low-income Medicare beneficiary, Slim B. I don't think I've ever signed anybody up for Slim B, but I just thought I'd throw that in there. These are some programs to help people pay for their Medicare Part A and Part B costs. Next. So to reiterate, so Medicare is a federally funded insurance program, and it's the same all over the U.S., right? Medicare bills are paid from trust funds from those covered that have paid into Medi. If you get your paycheck next time and you look on your paycheck, you will see something called Medi. That is what you pay into your out of your paycheck every month and have been doing it since you were started working. That goes into your Medicare fund, let's say, which enables you to not have a Part A premium, right? You pay for Medicare Part A costs, hospitalization costs, but you don't pay a premium. So that's where that money that you're paying in your check goes into. It's a trust fund. It serves people over 65 primarily, whatever their income, and it serves younger disabled people and dialysis patients. They pay part of their costs through deductibles for hospital and other costs. Small monthly premiums are required for non-hospital coverage. Next slide. So Medicaid is an income-based assistance program serving low-income people of every age. Patients usually pay no part of costs for covered medical expenses. A small co-payment may be required sometimes. It's a federal state program, so it does vary state to state, but it's run by state and local governments within federal guidelines. So, and I tell people, if you have Medicare, Medicaid, if you're dual eligible, you have some of literally the best insurance that you can have. It's even better than Congress. And if you can go to the next slide, dual eligibles are people who are entitled to A and B, and they also are eligible for some sort of Medicaid benefit. They can get their care through Original Medicare. They can get a Medigap. And you think, well, if they're on Medicaid, how could they afford a Medigap? Well, family members pay the premium for them because they feel like it's better for them to get the care they get with a Medigap, right? You're not nickel and diming your care. Once you pick that lettered plan, whatever is in that lettered plan, you're covered. You don't see bills. They might say this person has a lot of medical issues. It'll be cheaper for us to buy them a Medigap than to put them on Medicare Advantage plan. And they're paying for all the services on the back end. So we see that a lot. I do want to mention though, when people are on Medicare under 65, when they turn 65, they get what's called a reset into their employment, meaning they are now going to pay the same costs that anybody coming into Medicare would pay. So for instance, let's say they were on a Medigap and they were paying $650 a month for that Medigap. Believe it or not. And they're paying $208 or $205 for their Part B. So that's almost $1,000 in health premium. That's just premium costs. When they turn 65, that Medigap goes down to whatever anybody else entering Medicare would pay for that Medigap. And those run anywhere from $130 to $250, depending on the company you go with. So imagine you're paying $850 and now all of a sudden you're paying $150. I mean, that's just fantastic for our Medicare beneficiaries. And Colorado and 29 other states allow this. Next slide. Dual eligibles have some special rights and benefits. There's no late enrollment penalties if you're dual eligible. You can switch your health and drug plan more often. You get help with your drug costs. You get help with your premiums. And Medicaid may cover some drugs that Medicare doesn't. I've not run into this, or I've not been, privy to having to make this happen for somebody. But that's what we've been told, that Medicaid will cover some drugs that Medicare does not. Next slide. So who pays first? For services covered by both Medicare and Medicaid, Medicare is the primary payer for doctor's visits, hospital care, home care, and skilled nursing facilities. So Medicare would pay first, Medicaid paying second. Next slide. So how can we help? Well, we can help you find providers who's accepting new Medicare patients. We can help you compare your coverage choices, your health and Part D plans. We can also help with Medigaps. Actually, we have a tool now to help compare Medigap plans. We can help with bills and claims. We can help file complaints and appeals. We help people sign up for their, cost-saving programs like Extra Help, Medicaid, MSPs. We give referrals to other programs a lot, and they give referrals to us. We file complaints regarding Medicare Advantage and Part D plans. I'm the person that files all the complaints in the state. And you can imagine over, 10 years of doing that, I've seen it all pretty much, and I've seen the complaints, and, they follow a pattern. But I am the person that handles the complaints, and usually the complaints will rise to, it's usually where they just can't get any satisfaction with their plan. They can't get anybody to call them back. They can't get anybody to help them fix their situation. They'll either find SHIP and contact us. They'll try to file a complaint with their congressperson, who will then, get in touch with SHIP so we can help this beneficiary. But, we can't do everything at SHIP, but we can certainly get you to the people who can help if we can't help. And we have affiliates all over the Colorado. We have SHIP locations in many, many communities around the state. And so even if these calls come to the state office, if they live in Montrose, we're going to send them to their local SHIP, right? Because it's just better to talk to your people in your local community. Next slide. So these are just some Medicare resources. If you need to get in touch with SHIP, here's the national toll-free number for SHIP. Our Senior Medicare Patrol, they are our sister agency or sister program, and they combat Medicare fraud and abuse meaning financial abuse. And so we have somebody on staff that does that. Here is Medicare's 1-800 number, and also their Spanish speaking 1-800 number. I don't use this number as much because SHIP, we have a backdoor Medicare number that we call, but the times I've had to call Medicare, it's been fine. I mean, they're very knowledgeable about Medicare issues. They're not the people to call, like if you have a situation with your mom and there's, lots of moving parts, call SHIP. We would be the people to help you with that. Next slide. This is our senior health care web page that the DOI puts together. I thought I had put I think on the next slide I put the link. But this is where you can find all things Medicare. And I think if you just Google DOI senior health care page, it'll come up. But everything you want to know about Medicare in Colorado is here. There's a publication that I put together every year that has the Medigap information in there for the year, all the plans or all the companies in Colorado selling Medigaps this year. I do the Part D newspaper, which is down here, Part D options for Colorado, and it lists all of the Part D plans available for Colorado this year. And then I put together the, where is it at? This one, Colorado Health and Drug Companies. This shows all of the Medigaps Medicare Advantage plans in Colorado for this year. So this page is chock full of information about all the current plans. If you scroll down, there's information about S&P, anything really healthcare related Medicare will be on this page. So if you're not familiar with it, I say go and check it out. Probably can answer a lot of your questions here on this page. Yeah. Next slide. These are some resources that I have found in my work that are not only good resources, but trusted resources, right? Because the internet is like the wild, wild west out there. And the last thing you want to be doing is, just give it a bunch of information that you have found online. Now, a lot of it's really good. I'm not going to say that. And especially they've introduced that new AI feature I've noticed. But again, you have to sort of discern what is true and who has, who stands to gain from that website, right? So here's websites that I trust for Medicare information. Medicare.gov is a great website. It's the official website of Medicare. And you can sign up for an account here where all your Medicare stuff is housed there. Your drug list, your doctors, your plans from the last 3 years, any claims that you filed. Everything is here on Medicare.gov. And I know people do not want to sign up for one more account. I get that, but this is the one. If you're on Medicare, this is the one to sign up for because, you can go right there and everything Medicare is there. SSA.gov is another trusted Medicare website. Not as much information there, but, we're like sister organizations. So but this again would be where you enroll. And then CMS.gov is also a trusted website for all things Medicare that I use as well. Another one would be Kaiser Family Foundation. And I didn't put it on here because it confuses people. It's not the Kaiser health plans. It's the Kaiser Family Foundation. And they do everything that has to do with healthcare. Their data is on point. I get a lot of my information that I use for training there, but it's called Kaiser Family Foundation, just if you're interested. Next slide. And that is it for me. Any questions, comments, suggestions? I'm certainly happy to help with anybody's, if something comes up after and you want to email me, please do that. Your parents or, somebody who's sort of struggling with this stuff, just have them call our office. Get the information directly from us and not a neighbor, right? Just have them call our office.
We do.
Kathy, we do have a couple questions. First
Of
from
course.
Monica and then from Pam. Monica?
Yes, ma'am. Hi, Kathy.
Hello.
It was actually a twofold question quickly, and then if you need, I can email you, if you don't have the answer right now.
Okay.
But you mentioned about the 40 quarters or the
Yeah.
10 years. I'm short, I believe, 3 quarters
Mhm.
for Social Security, but I've worked in excess of 10 years, of course. So is that the same as me being eligible for Social Security benefits, which since I'm also a widower, then I would have my husband's benefits for Medicare. Not Medicare, but for Social Security.
So the Social Security and the widower's benefits, I don't know about that. So I don't really want to speak to that. But I know there's if you've been married 10 years and others, but I don't know that one. But for Medicare, if you don't have 10 quarters in with Social Security, you're going to pay a little more for your Part A. But it doesn't preclude you from getting Medicare. But if you're still working for HCPF, and are you planning to work for a couple more years? Well, by the time you go on Medicare, you're probably going to have your work quarters.
Well, we don't pay into those.
Oh, that's right. You're like us. That's
Yeah,
correct.
we don't pay into. That's why I
that
don't
is
have any.
correct. I
Because the
forget.
majority
Yes,
of them, yes.
that's
yeah.
right. That
Yeah.
is right.
Mhm.
I had careers before I started here. That's why I have my work quarters.
And I
Correct.
did, but all of them are still government
I gotcha.
for the most
Now,
part.
yeah.
But it's the 10 years. I think I would be eligible for Medicare because I've worked the 10 years.
Not eligible. You're eligible if you're 65 and you're a permanent resident in the U.S.
That's
It's whether or not you have to pay that Part A premium or not.
right.
Right. And if you have, let's say, 9 work quarters or instead of 10 years, you have 9.5, your Part A isn't going to be 565. It's going to be based on how many work quarters you have. Your Part A may be 120
Mhm.
because it varies depending on how many work quarters you have in.
Okay. And I think I have like 30 plus.
Yeah.
Okay. And so maybe there's something, but the other question, and I definitely can speak with you on that later, but it was where I did not take the Medicare and I am 65 plus.
Okay.
And so when you mentioned that, that's the first time I've heard that I could go ahead and take the Part A
Mhm.
and just let it kind of just have it,
Yep.
there.
Yep.
So I really would like to know more about that, because if that's the case, then I'll go ahead and do it, because I currently have our work insurance still, and I'm fine with that because I have the high deductible. So is that something I can contact you about to just make sure that I'm doing this correctly with this Part A?
Yeah.
Take it, and
Send
then
that to me by email. It's going to be a Social Security issue in the end, but
Mhm.
send it to me so I can just sort of decipher what you're saying and make sure, because I might be able to just answer that for you and send you some resources. But yeah, go ahead and send that to me.
Okay.
Let me give you guys my email address while I thought I put it on the slide. I apologize for that. It's Kathy with a K .Madden, MADDEN at state.co.us.
Thank you.
You're very welcome.
And if anyone, sorry, I'm going to interrupt here, Pamela. I know you're next. If anybody has any questions about her email, you can contact me or Gina. Thank you.
Hi, Kathy. Great presentation. And this may talk to Monica too. When you hit 65 and you are on a high deductible health plan with an HSA, you can't have both, correct?
You can have it until you get on Medicare.
Okay, so, and that was my second part of my question. So if I wait until I retire at 67 or 68, will there be a special enrollment period for Part A too?
Yeah, so if you continue to work, like I'm going to just continue to work, and I'll probably work, I don't know, I'm thinking now till I'm 70. I'm an
Me
over it.
too, yeah.
No, I don't know if I'm going to work that long, but I'm going to work some more for more years. So tell me one more time.
So right now I'm on the high deductible health plan with an
Yeah.
HSA.
Yes.
When I hit 65, I've been told that you cannot be on Part A and have an HSA.
Right. That is correct. So you have to make a decision about what you're going to do. I didn't have an HSA, so I went ahead and got my Part A.
Okay. So when I decide to retire and lose my creditable coverage through the state, will Part A be part of that special enrollment period? Or will I
Yes,
be
of
penalized?
course. Yes. A and B and C and D. Absolutely.
Okay, great. That's what I needed to know. Thank you so
Mhm.
much.
Yep. Any others? I thought I
Robin.
said Robin.
Robin, you want to go?
Hi there, Kathy.
Hey.
I'm like days from being 65, which used to sound like 100, but of course it isn't anymore. But so
I'll give her a round of applause for making it. Hey, that's a feat. I mean, you paid your whole life into this program. Good for you. We're finally, yeah, I love it.
I know. So I am intending to work past 65.
Mhm.
But you had said earlier, like I'm going to retire maybe, well, I'm shooting for 70. So am I still signing up for Part A before or at my 65th birthday?
You certainly can, but you don't have to. And the only reason I did it is because I paid in, right, for my 10 work quarters. So it's premium free anyway. So I thought, why not go ahead and get it and then let it sit in the background, because my employer insurance at the state is going to handle my hospitalization. This is just sitting as a secondary insurance in the background. But I didn't take my Part B because there's a premium attached to that. Right. So no sense getting that, because then you're overinsured, number one. So yeah. Yeah.
Where did your Part D fit into all that then?
I get Part D through my job currently. I don't need to worry about that. But when I go on Medicare, that's when you got to worry about getting your D or you get penalized. But right now, most people working, it's all combined. Health and drug is already combined.
So Part D as in dog is not necessary at this time either, as long as I have a state plan or whatever.
That's correct. That is correct. Yeah.
Okay, thank you. I think I can breathe. I really
But I tell you not,
appreciate
Robin, when you get ready to retire, though, when you get ready to do all this, and that's everybody on the call, I would just recommend contacting SHIP and just say, hey, I'm coming from the state. Kind of tell me what my options are, because you're not going to remember this in 5 years. Tell me what my options are. What do I need to do? And then let them sort of guide you based on your situation then, right? Because this stuff is so fluid. We don't even know where Medicare is going to be at in 5 years. So it's I would just say, kind of keep this information in your back pocket. But when you're ready to go in, contact SHIP and let us kind of guide you through the process. And we're free. We're unbiased. We have no stake in the game. We're just trying to make sure people make the right decisions going into Medicare.
And I have to sign up for Medicare through Social Security, the SSA.gov website.
Yeah, correct. Yeah.
Okay.
And it'll say, as soon as you get on, just start enrolling in Medicare, and the button will come up and say, ready to apply. And then it'll tell you what all you need to apply. And I'll tell you what you'll need, because I just went through this. You're going to need your dates of employment from the state. And if you have those dates, go ahead and make sure they get those. Any boxes where you can put notes that if it's something weird they need to know, make sure you put it in those boxes. But the most important thing, they want to know you had creditable coverage when you went on to Medicare, and you do because you work for the state.
Okay. All righty. Thank you so much.
Sure, call me if you need me to, Robin. No worries.
You bet. Appreciate it.
I think our questions are done, but I do have a comment for anybody that is, all these questions that I heard there, something similar. I too just turned 65, and I do also intend on working till I'm 70 or fall off of my seat here. But there's a misconception or something out there, and I know that I heard this, that as soon as you turn 65, you have to apply for Medicare. You don't have to, and like Kathy just said, as long as we have letter saying that we were covered medically through our for medical through our HR, and HR will provide that letter. Our human resources will provide that letter. And if anybody has any questions, they can contact Deb Becerra over in our HR. So she's always able to help.
Yeah.
I did, Kathy, have a few questions on.
Can I just interject on what you just said though?
Yes, please.
If you decide you're going to sign up for Medicare, HR may or may not send a letter. They may not have to. When you're applying and you put in the dates that you had employer-sponsored insurance, they may not. That might be enough for them, right? Because I don't know, they got special powers. They can look stuff up. I don't know. But anyway, you may not need a letter. You're only going to probably need a letter if you didn't put those dates in. And then you get a letter saying, hey, you're going to have a penalty because you go, no, I work for the state. Then you might have to get a letter from HR to prove to them you had it. But if you just in the application, put your dates of employment in there, and then I think they ask for a name and address of your employer, you should be fine. Yeah.
Agreed. I did have some questions on, you mentioned Part C, MAPD. It has prescription coverage in it.
Mm-hmm.
If you get that coverage, do you also have to get D coverage? And I know
No,
that D coverage.
it's combined.
I'm sorry.
In that particular instance, if you got a Medicare Advantage plan, health and drug is combined.
So you don't have to pay you don't have to get the D. Okay.
Right. Only if you have original Medicare or a Medigap do you have to get a standalone drug plan.
I see. And is there an extra charge for a Part D?
Part D plans have their own premiums attached. There is a zero premium plan out there this year, WellCare, which covers all the standard drugs. I mean, but again, to me, what drives a drug plan are all your drugs on the formulary. That's the first thing I'm going to tell you. And if you pick a plan and all your drugs aren't on the formulary, I'm going to say rethink that plan, because what happens if you can't get your drugs throughout the year, right? People tell me, well, my doctor gives me that now for free. Well, what happens if your doctor retires and you can't get it for free? So to me, what drives picking a plan are all your drugs on the formulary. If yes, let's move forward. If no, let's look at another plan.
Great. And the last question, can you apply for Medicare and not Social Security? As a lot of us are working and are planning on continuing to work for a long time, can we apply for, let's say, Medicare, but not Social Security? Do you know that?
Yeah, absolutely you can.
Okay.
Social Security, you can sign up at 62. Medicare is 65. And then, of course, if you get to your full retirement age, like me and Robin's would be 67, now you can start at 67, you can get your Social Security and continue to work and get your Social Security. It's called full retirement age. So once you get there, you can get your Social Security and and continue to work. Yes.
Okay.
But yes, you can get Medicare without collecting Social Security. I'm on Medicare now and I'm not collecting Social Security.
Excellent. Well, thank you.
Mhm.
And just a quick thing. The premiums are out of this world. I can't believe
Yeah.
that.
And they've been going up. I mean, yeah, this one was really the biggest increase I'd ever seen. I went from 185 to 205. That was the highest premium in the 12 years I've been doing this. So buckle up.
Wow. And those are per person per a month.
Yeah,
Wow.
per person, and everybody on Medicare pays, whether they get it paid for them through a program or they pay themselves. Everybody pays that Part B premium. It's what, you know, it keeps the program afloat too. Because think about it, if Medicare said, you know what, it's voluntary, sign up for Medicare if you want to, how many people would be on Medicare?
Right.
But this way, everybody's on it and everybody shares the
The
costs
burden.
and stuff.
Right. Very much appreciated. Thank you very much. Anybody else have any other questions?
Certainly email me if you have any if you have any kind of, question, scenarios that you just want to talk to. I'm happy to do that. Give your friends and family my number. That's what we do. And it's very frustrating when you can't reach somebody to answer these questions, get questions answered. So we're happy to help. That's what we do.
Right. Thank you. And if anybody also has any questions, this whole presentation was recorded, and we are also going to post the slides later on. So in case anybody needs the contact information for a SHIP counselor, we have the phone number.
Excellent. Well, thank you for joining me. I appreciate it. Thanks for
Thank
asking.
you.
Yeah, of course.
I did want to, I'm not sure if you have access to the comments on the side. Everybody said, thank you. Outstanding presentation, Kathy. So informative. Thank you for taking the time out of your day to share with us.
Oh, thank you so much. Excellent.
Thank you for the presentation, full of valuable information. Very informative session. And this is from our director of EDIA. Thank you, Kathy, Dora, and a group for the ages. Thank you very much. Thank you for the presentation. Very informative and helpful. And those are the comments. Thanks again, Kathy. And thank you everyone for attending.
I appreciate you asking me. Thank you guys. And the more we know about Medicare, the better it is for everybody.
True. Even if it does change, we at least have some information to when we get there, we're prepared.
Absolutely. And we can come back and do this in a couple years, update you guys.
That would be amazing. And now that I know that you're going to be there for a long time, like me. Thanks, everyone. Bye.
All right. Bye.